Ready?
Hang on.
Well, good evening, everybody. Good to have you here. We are here at the Fasciitis Sandy Springs video studio, and I'm here to talk about injuries as a little fireside chat, as it were. And Jeff Galloway is our producer and director, and fortunately has provided the good technical backup for this. We're going to be a little bit interactive here. If you have any questions, please let us know, because I want to answer all of those. I'm going to be talking about injuries, or rather the prevention of injuries, and the textbook for this is my book, Injuries, which I wrote with Dave Hannaford, a renowned podiatrist who carries the medical weight, and I will be talking about as one runner to another. This is none of this is meant as medical advice. You get that from a doctor. So I'll be talking about having gone through a lot of injuries, having worked with a number of doctors, and how I found the best way to avoid injuries. And it starts with knowing your weak links. All of us have weak links, and they are the ones that ache more when we have run a little bit more than we should have, or they don't allow us to run for several days or several weeks if we keep pushing once we have felt the first irritation of a weak link. Now, weak links are varied among individuals, and they're based upon your range of motion, the type of training that you do, your genetics, prior existing damage that you may have had in other sports or in the problem areas of running. Now, a lot of people assume that if you run, you're going to get injured, or you're going to have some debilitating injuries, such as knees or hips or other things. The research on runners and injuries does not support that. It shows that runners tend to have healthier joints as the decades go by. The most formidable research came out of Stanford, in which Dr. Fries found in his population of thousands of runners over 50 that have been running 20 years or more, that the runners, as the decades went by, had less than 25% of the orthopedic complaints compared with non-runners their own age. So, and this was based on people that didn't necessarily take walk breaks. Once you add walk breaks in there, our findings in our Galloway training programs are that the incidence of injury goes down to almost zero. So there's a lot that you can do to avoid injuries. But again, going back to the weak links. The weak links are going to start by being a little sore. And it always helps to have an extra day or two off when that happens. Now, if they become worse than just sore, or the soreness lasts for a number of days and interferes with your ability to do certain workouts, then you need to take some action here. The first thing is that 3 to 5 days off can really help the healing when you are at the beginning stage of an injury. And you're not going to lose anything even if you lay off for 5 days in a row that you can't gain back in the next 2 days of running. So your body wants to heal itself. It's programmed to heal itself, especially with the type of injuries that we get when running. But you have to help your body by backing off first and then treating it. There are several signs that your possible soreness or aggravation in a weak link area is headed towards being an injury, or maybe is an injury. The 3 signs are inflammation, that means swelling, loss of function, that means that the foot, leg, whatever, is just not tracking the way it usually does, and the third is pain. Now, I'll have to tell you that pain is something that most runners have, at least temporarily, on most runs. But most of these signs of pain are not a sign that you have an injury. It's just a nerve that got entrapped, or you stepped the wrong way on a rock, and it's a very temporary type of pain. My advice in dealing with this one is take an extended walk break of 2 to 3 minutes when you feel a sensation of pain, and then start back after that extended walk break with a much more gentle run, walk, run. And in most cases, I found that the pain tends to go away when you take that action. If it doesn't go away, then take another extended walk break and start back with very little running, such as 5 to 7 seconds of running and 30 seconds of walking. Again, in most cases, your body's going to adapt when you have such short amounts of running and walking. And I'll talk more about that a little bit later when I get into run, walk, run as a prevention of injury. However, if the pain does continue after you've shortened up the run, walk, run, that's a sign that the run should be over. Now, Brennan, is there anything else along those lines that you think I would need to amplify or cover?
No, you want to get into briefly your current injury situation?
Well, that's a good example here. True confessions, folks. I currently have an injury. Now, it's not a running injury. I injured myself a month ago when I was on an elliptical machine in a hotel exercise room. The machine was going through a range of motion that was not my range of motion, and I mistakenly felt so good that I dialed up the resistance on it and pushed the duration of the workout significantly farther than I had ever done, and I paid for that. I actually strained my glute muscle rather severely, and fortunately I am making my way back now, but I had to drop out of 2 races along the way, the Tobacco Road Marathon and the Star Wars Half Marathon. So what I did to really get the healing on track is, first of all, really back off the running portion. I only ran every 3rd or 4th day during that healing phase. And one stretch, when it didn't seem to be making any progress, I didn't run at all for 5 days. And once you start back after a 5-day layoff, I will warn you, you're going to feel a little awkward at first. So you really do need to build back really gently. And then once you get the healing started, every other day running is a smart thing rather than every day. But the every other day will keep your adaptations in place, and it will also allow for healing if you stay below the threshold of further irritation. Now, what that means is that either at the end of a run, you may feel some symptoms of the injury, but if you're staying below the threshold of further irritation, at the end of the run, the situation is no worse than it was before, and the next day you want to feel an improvement in that. And then over time, by staying below the threshold of further irritation, your body tends to heal the injury even while you are continuing to run. But you may have to have some adjustments along the way. Now, the treatment mode for a weak link irritation depends on the site of it. If you're dealing with an area near the skin, such as the Achilles tendon or something on the foot, the ice massages really work best. And I'm talking about freezing a styrofoam or paper cup and peeling off the outer layer, rubbing it at least at night before bed for 15 minutes of continuous ice massage rubbing on that site. And doing that at least before bedtime is really the best time, because the healing that goes on for injuries occurs mostly at night. And so you want to predispose a possible injured area to the maximum amount of healing by treating it right before you go to bed. The other signs or the possible symptoms of an injury are inflammation. Well, inflammation can be in muscles, tendons, and it also can be in joints. And if the inflammation is in a joint, it doesn't take much inflammation in the knee, for example, or hip to cause those two areas to hurt, particularly if you have the beginning stages or minor stages of arthritis, which most people over the age of 45 have to some degree. The good news is that anti-inflammatories can often take that pain away and also take some of that irritation potential away, and anti-inflammatories have been very effective in joint-related injuries, but you should never self-medicate. You really need to talk to your doctor about that, because he knows what your specifics are and can advise which medication and how much of it. But anti-inflammatories have a place in treatment. The doctor needs to advise you on that. And then in the third area, the muscle area, massage has been the best form of treatment. And there are two different types of massage. One of them is what is done with the stick and the foam roller, and that is to move junk out of an area that is damaged. There are a number of injuries that if you don't move the junk out regularly, then the injury is not going to heal fast, or it may not heal completely. So you really do want to get some good advice there. And a deep tissue massage therapist is the best practitioner for moving junk out of an area. The other type of treatment for muscles is a massage that can invigorate and bring blood flow into the area. And the best tool that I have found has been this BFF machine, which has been quite amazing. As a matter of fact, this is what I have been using to bring my glute around, and it really has done the job here. It looks like a car buffer, doesn't it? Well, while it does turn around in circular motion, the real effect of this is to put this on the tissue that's affected and rub it up and down and around to warm up the area, and then turn it up if you've got a certain sore area and put it right into that area. It is amazing how good that can feel when your muscles have been achy, exhausted, or there is some type of damage that's been there for a while. The bringing of blood flow promotes healing, and it promotes it better than just about anything you can do. And again, this is the best machine I have found for bringing that vibration massage that can really not only invigorate tired muscles, but bring that blood flow into the area. Now, before I pause a bit to see if you have any questions out there, I wanted to talk about RunWalkRun as a prevention device. The method is something that has allowed people to continue running through injuries in thousands and thousands of cases that I have when I have worked with folks. The concept is simple. If you shorten the amount you're running and you take the walk breaks more frequently and you adjust them so that there's not too much stress put on the weak links, then your body is going to allow the healing to take place. An example would be someone who was using a 60-second run, 30-second walk before they got injured. Well, once they went through the treatment for a week, say, which is a pretty standard amount, and started back, the start back should be something really gentle. And I'm talking about only 10 seconds of running and 30 seconds of walking, or even 5 seconds. Now, the running motion can even be more of a shuffle, because the more you're shuffling with your feet low to the ground, light touch of the foot and a short stride, the more the ankle is going to do most of the work, and the less the leg, the joint, or whatever is your weak link is going to be aggravated. So by shortening the amount you're running, make it more of a shuffle, and then doing the walk breaks more frequently, you can lower the aggravation on an area and stay below that threshold that allows the body to heal itself. So, Brennan, do we have any questions from anyone?
Nobody has commented yet, but if anybody has any questions, go ahead and put them in the chat here.
Yeah, is there another area that people have expressed interest in that I could cover right now?
No comments so far.
Well, let me go over some of the aggravators of injury. The first one is denial. In other words, you have gotten those preliminary signs of inflammation, loss of function, or pain that doesn't go away, and you deny that it really could be an injury. As a result of that, one run when you have an injury can significantly set you back and increase the damage exponentially, so that you have weeks or sometimes months off even from one run when you're already injured. So it's always safer and best to take at least 3 days off, because again, you're not going to lose any conditioning by doing that, but you gain the chance to get the healing pretty much taken care of if it's at the bare beginnings of an injury. And then the other aggravators are things that you probably already know, and that the first one is speed, running your runs too fast. Either it's too fast, period. You go out with a fast friend and try to keep up with that fast friend. Or you decide that you want to do some speed work and you jump into it, either running the speed work too fast for you currently, and this is particularly true for those who are making a comeback into speed work. They've taken some time off and have run mostly easy, and they decide they want to get in shape for an upcoming race, so they try to come back to the same speed and the same type of workout that they were doing when they were doing speed work regularly. That is a formula for injury disaster. So ease into speed work, be very sensitive, even more sensitive than normal when you are going back into a speed workout situation. And then at the very first sign of something that could be an aggravation due to the speed work, take several days off and treat the injured area or the possible injured area, and then come back very gently. Most speed work issues in our Galloway program are not due to pushing at too fast a pace, because the pace that we have in our speed work is really not even close to all out. But if you do too much, or you skip a workout and then try to go back on the schedule by a significant increase in the amount, you can incur some problems. Just remember, speed kills. It can really damage tendons and ligaments and feet and joints and things like that. So try to stay within the bounds for which you have been doing, and then after you've warmed up, you can ease in to faster running.
All right, so we have two questions. First question comes from MW, and that is a recommendation for recovery for knee injuries.
MW, thank you for your question. Knee injuries, that is one of the most common sites of injury. It really helps to get a good diagnosis always by a doctor that has seen a lot of running injuries. There is a difference in the advice that you tend to get if you're going to somebody that a doctor that just wants to get you out of their office. So finding a doctor that wants you to continue running is the big thing. Now, for knees, once you get the diagnosis, you can see various forms of treatment. However, if it is due to arthritis, which is a common partial cause, and I say partial cause because there's a high percentage of those over 45 that have some form of arthritis. But arthritis is usually not a deal killer for running. You do need to take care, though, and make sure that you don't push too far into the pain that's in a joint, even if it's only a partial cause of arthritis. Again, the anti-inflammatories have worked fairly well, so you need to talk to your doctor about that. Watch your stride length. A very common cause of knee and other joint pain is that the stride length is too long and the bounce off the ground is too much. So by shortening stride down to a shuffle and then warming up very gently with more walking than running at first, say a 10-second run and a 30-second walk for 3 to 5 minutes, and then a 15-second run, a 30-second walk for 3 to 5 minutes, and then progress as your knee lets you. And if it really starts to hurt, take a minute or two to reset everything, or even 3 minutes, and then start back with a very gentle amount of running that doesn't cause the pain to increase. So without knowing specifically what the problem is, again, going back to your doctor or somebody that really knows you and knows the medical issues is a very good idea.
Okay, another question comes from Tamara Spietzen, and she's wondering about weak ankles, things that you would recommend to strengthen ankles.
Is it Tamara?
Yeah, I think so.
Tamara, thank you. The bottom line on ankles is that you need to look at the surface that you're running on, because any little irregularity can throw the ankle off and cause ankle turns and all types of issues there. So a stable surface can prevent most ankle injuries. That said, make sure your stride length is not too long, particularly in the beginning of a run. And you need to warm up much more gently by walking 3 to 5 minutes first, and then using really baby type run walk runs of 10 seconds run, 30 seconds walk, or even 5 seconds run, 30 seconds walk. By going down and gradually building up, you can find a ratio that's going to work for you in most cases, and that can help you avoid ankle going over. Finally, when your body is really, really tired, you're going to be more susceptible to ankle turns. So not only do you need to look at the surface and keep your stride length relatively short, but you should probably take some extra walk breaks at that point to make sure you don't push yourself so far into fatigue that whenever you have an irregularity, your ankle is more likely to turn. So be careful, run stable, and don't get too tired.
Anybody in the store have any questions?
Yes, audience, your time to be the star of our video blurb here.
You're shy.
Yeah.
Anybody have any injuries that are bugging them right now?
Thankfully, no. Staying injury-free thanks to RunWalk.
Well, Brennan, what do you think?
Well, anybody else online have any specific injury questions or general running questions? I think we can probably open it up to anything that anybody is interested in at this point. You could talk about the special discount.
Oh yes, we have a special
discount
deal
our
for
viewers.
you this evening. 20% off on non-sale shoes. And so what you can do is go to our website and go on the e-store and shop jeffgalloway.com. Is that correct? Shop? Is it? There's a dot after shop?
Yeah.
Shop.jeffgalloway.com. The coupon code for the 20% off is STREAM. STREAM. So 20% off, folks. That was a word from your sponsor. We're here at Fidipides Sandy Springs in Atlanta, Georgia, and the producer-director is Brennan Galloway, and I'm just here to talk.
All right. Yeah, I don't know. Any other common questions that you get? Common places that people get injured?
The common injury issues that I get are why doesn't this injury heal up? Or why do I keep getting the injury in this place? Some of it's genetic, some of it's our range of motion, but the most common ways that people can avoid those irritations, first of all, adjust your RunWalkRun. It may require, in the healing, to get the healing started, that you walk all of your runs for a week. Walking is going to maintain most of your running adaptations and all of your endurance adaptations. So if you're on a schedule to do a half marathon or a marathon, it is perfectly okay to walk every one of the long runs. And that often means that you don't irritate the area that's getting hurt. And it allows you to continue with your fitness level and your endurance level so that you don't miss anything there. On the short run days, if you can run with short running segments, that again is the preferred way to go, but temporarily a lot of runners who develop an injury need to back off. And once you do that, you allow the body to heal itself, which it wants to do. The common areas of injury today are plantar fascia, iliotibial band, and Achilles tendon / calf muscle areas. The other general area is the knee, and there are so many different injuries that the knee can get into that I don't really get into it unless I know what is wrong with the knee.
All right, so that's a perfect segue. Sarah Richmond has a question for advice for coming back from nagging plantar fasciitis.
Well, Sarah, that's you teed me up right away because I was about to talk about plantar fascia. First of all, you want to protect the foot right from the beginning of the day, and putting your foot in a stable and supportive shoe before you step out of bed, and support your foot all day long. Don't even walk barefooted, and don't wear sandals or other things while you have plantar fascia. Some runners who have plantar find that an orthotic or even an over-the-counter type orthotic can help reduce the rolling around in the shoe that can aggravate that. One of the most common reasons that I see when I am talking to runners about their plantar healing, and the reason that it doesn't heal, is that they try to stretch the plantar fascia, which keeps tearing the plantar out so that it can't mend itself. I've talked to a number of folks and doctors and physical therapists about that, and there are certainly certain aspects of plantar fascia where limited stretching mode can work, but this is very, very limited according to the experts in the field that I have talked with. And in general, stretching a plantar fascia that is injured is going to tend to either aggravate it or just simply keep it from healing. Rolling the plantar fascia every night can help bring some blood flow in, and this BFF machine has been used by a lot of plantar fascia sufferers to increase the blood flow in the area. What you do is you first put it very gently on the plantar area, and you rub it for about a minute or two, and I'll take my shoe off here and show you what I'm talking about. So what you're doing here is very, very gently at first rubbing it over the surface so that you're not feeling it very much at all. This is warming it up. It's getting the foot used to the vibration motion that the BFF has. And then when you get it warmed up after about a minute or so, you can sort of concentrate on the area where you're feeling most of the pain, which usually occurs first thing in the morning when you get up. This BFF has been a great tool for a wide range of injuries. In the foot, it's amazing how good the foot can feel if it got banged up in a long run or a speed workout. Again, the BFF tends to bring more blood flow in there, which really helps it revive, and it helps injuries heal up. So in general, don't stretch. Support your foot all day long, and use some form of a vibrating massage. This is the best I've found, but you can do this to a limited extent by using your own fingers on that area that tends to hurt when you wake up in the morning.
So that's all the questions that we have right now.
Okay.
So maybe we can we'll wrap it up and then be back
If
tomorrow.
something comes up, okay,
Yeah.
good. Okay, well, we've gotten through all the questions, and if some come in the next minute or two, I will definitely address that. Tell your friends and fellow runners that they can tune in tomorrow, and we will be on location at Phidippides Ansley Mall in Atlanta, Georgia. And I want to thank Brennan Galloway for being the executive producer and director of this video. And I hope to be talking with all of you and more of you tomorrow. So have fun, and we'll see you tomorrow.